Hello and welcome to the webcast Beyond the Diagnosis, How Type 2 Diabetes Impacts the Financial Health of Canadians. My name is Andre Picard. I'm the health columnist at the Globe and Mail, and I'll be the host and moderator for today's discussion. To begin, I want to acknowledge that the Globe and Mail's headquarters are situated on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We're grateful for the opportunity to live and work on this land. Today, we'll be talking about how type 2 diabetes impacts not only physical health, but financial health and mental wellness. Our goal is to explore the intersection of diabetes, finances, and mental well-being, and of course, to share some tangible strategies to help Canadians manage these challenges. We have a great group joining us today for the conversation, and of course, we welcome your questions. Just type them in the Q&A, and I'll incorporate them in the conversation as we go along. We're going to start with a one-on-one chat with Laura Cyron, President and CEO of Diabetes Canada, and then we'll move to a panel discussion with three other specialists. And as I mentioned, you can get your say in by typing into the Q&A function. So I want to start by welcoming Laura Cyron and thank her for joining us today. Hi, Laura.
Hi, Andre.
I wondered if we could start with just a little bit of context to give us an idea of how many people are living with type 2 diabetes in Canada.
Yeah, so thanks for that, and thanks for having me here today. Right now in Canada, there's over 3.6 million Canadians who live with type 2 diabetes. In fact, all diabetes is over 4 million. So if you think about that, that's 10% of the entire country. And about 90% of the 4 million live with type 2, so 3.6 million. So it's a really, really prevalent disease.
Very common. It affects your heart, your kidneys, your life. And today we want to focus on it affects your finances too. So why is it expensive to live with type 2 diabetes?
Yeah, and what I should say up front too, Andre, is I speak today here as the President and CEO of Diabetes Canada, but I also myself live with type 2 diabetes. So I'm coming at this with a very personal take. So diabetes as a disease is a 24/7 disease. It never takes time off. And because of that, it can be quite expensive. There are medications, there are devices, there are supplies. So if you're on insulin, when I say supplies, things like needles, test strips, things like that, syringes, etc. So trying to manage diabetes is an ongoing cost. The cost never goes away. It's not episodic. It's not like you take your medicine for a while and you stop, right? So it's a chronic disease, and that can really add up. So across the country, what we know is if you don't have private care, on average, you're paying $10,000 a year out of pocket for your cost to live with diabetes. And that's an after-tax dollar under, so that's a very, very significant cost for people.
But we have Medicare in Canada. Isn't everything covered?
Yes, exactly. Well, wouldn't that be nice? So, first of all, it's patchwork, as you know, across the country. So depending on what province you live in, things might be covered and things might not be. So some of the basic medications may indeed be covered. But what we know is for what people need, almost half of the provinces and territories will only cover up to about 20% of what diabetes is actually costing someone. So again, yes, some stuff is covered. Increasingly, I'm excited to say that some devices are increasingly covered, although that still tends to be for people with type 1 diabetes and not so much for type 2. So for example, if you may have if you live with type 2, you may have your medication covered, but you don't have your continuous, I'm pointing over here, your continuous glucose monitor covered. If you're on insulin, you may not have as many strips as test strips as you need to be testing if you're not on a device. So it's often a mix of things. Yes, some is covered, but some of what you need isn't.
And you mentioned devices. Are they the principal expense, or is it more the everyday supplies?
It's everyday supplies and the medications, right? So depending on whether you're on an oral medication, whether you're on insulin, what kind of insulin, but then the supplies. So we often get people increasingly now, unfortunately, calling and saying, I actually have my insulin covered, but I actually don't have the needles covered. Or I don't have this, so I actually am rationing my insulin because I actually can't find a place to afford my needles. So it's a real mix, Andre. And again, unfortunately, it depends where you live in the country.
Yeah, like a lot of healthcare, I guess, kind of a postal code lottery. The
That
devices and the strips are covered differently, and depending on where you live.
Exactly. And for your diabetes, are you like I'm on oral medication? Are you on oral? Are you on insulin? What is covered? What age are you, Andre? So for example, for some seniors, and diabetes gets more prevalent as people age, some seniors in some provinces are covered for more supplies than others. So again, depends on your age. It's on your postal code, on the kind of diabetes you have. It's a real mix.
And we're hearing a lot these days about GLP-1 medications, these miracle weight loss drugs, but initially those were diabetes drugs. Are those covered for Canadians with diabetes?
Yes, not really is the quick answer, and they can be expensive. So, but they, as you said, one of the things that we're really trying to explain to people is that many of these GLP-1s, the sort of Ozempics of the world, et cetera, are actually primarily indicated for diabetes. Yes, for weight loss too, but for diabetes, and they can be incredibly effective. So, in my case, for example, some insurance companies cover them. But even to get coverage, Andre, you have to show that you failed other medications, and then you have to do special requisitions, etc. So yes, they can be covered, but even in the cases where it are, there's a lot of hurdles that one may have to jump over. And sometimes, again, depending on your postal code and where you work, you may not have the ability to jump those hurdles as well as other people.
Now, we talked about the numbers, we talked about weight loss drugs. There's kind of this impression that diabetes is just people who are overweight, but
Yes.
there's quite a mix of people. I know getting to a certain age. A lot of people in my age group start getting diabetes, pregnant women. Who does it affect?
Yeah, so it's a great question, and thank you for it because it increases as you get older, but your ethnicity plays a huge role. So if you come from an indigenous community, a South Asian community, a Black community, your family history, was there type 2 in your family? Your environment, where do you live? Are you able to access healthy foods? Are you able, if you live in sort of what might be called a food desert, what does that look like for you? So diabetes, if you actually sort of took a picture of folks with diabetes, it would look pretty representative of Canada. Different ages, different genders, and so, but more towards the older, yes.
Okay. Now you get a lot of calls from people. What do they tell you about their struggles, particularly their financial struggles?
Yeah, so we have a 1-800 line, and just for people listening, it's 1-800-BANTING, and we always encourage people to call because we're there for support and information. And when I started here 5 years ago, our number one call was more for diabetes education. I just got diagnosed, or someone in my family did, and we're thinking about meal planning, or we have questions about medication. Increasingly, Andrew, over the last 3 years, our number one call is about financial and the struggles people are having. And are there places they can get coverage? What might insurance companies cover? And then the mental health impact that comes from that, because when you or someone in your family who you're trying to help with their diabetes, can't always afford their medication or are truly making choices about, I have to manage my health, but I've also got to put food on the table for my children, or I've got to pay rent. This has a real impact on the mental. So we are hearing more and more people saying, I've been diagnosed. I used to have coverage, say, in a job. Now I'm in a different job and I don't have coverage, and I'm really struggling affording my medications or my devices. Or I still have coverage, but sometimes we're getting increasing costs. I can't even afford the copayment. And so what should I do? Do I, eat sort of worse and have my family eat worse, but keep covered? I mean, the choices people are being faced with, Andre, it's really difficult to hear, and it's difficult for them to be living with.
And we're kind of in the midst of this cost of living crisis. Everybody's stressed by the cost of living. Add $10,000 to that. I can't imagine the impact on your stress.
Well, and in particular, we see all the time about the cost of living, particularly what groceries cost, right? And so imagine you've been diagnosed and you go and you're trying to do all the right things. They say eat better. So you try and you're trying to eat healthier. Well, and then you're filling your shopping cart and you can't afford that. And so what you can afford is actually not going to help your health, right? So in particular, we're seeing people struggling with the cost of foods.
And then and you mentioned the meds. The last thing I want to ask you, we have a new pharmacare law that's come in. One of the things that's covered is supposed to be some diabetes medications. So
Yes.
what does that mean practically? Is that helping people?
Yes, it's starting to, but unfortunately, so far it's only been picked up in a couple provinces and it hasn't been fully implemented. So it's taking a long time. When it was first announced, we got a lot of very hopeful people phoning our line, Andre, saying, "Hey, tomorrow can I go to the pharmacist and this is free?" And the answer is not really. So we've got 4 provinces that are working on this. Right now, of course, our federal government is not committing to more money into that program. There's lots of things going on federally, as everybody knows right now politically and where the money needs to go. So I think it was a good start, but it hasn't really provided the relief for many people across the country that we'd hoped.
Yeah, so people with diabetes are kind of in limbo in lots of the country, I guess.
Exactly, exactly.
Yeah. Well, let's move on to the panel. And Laura, please stick around. We'll bring you back in. There's some questions already coming in, and we'll work those into our conversation. So thanks for setting that up. And let me introduce the other panelists, if I
Thanks,
could.
Andre.
Thanks. So let me introduce, we have 3 more panelists joining us. Michael Van Alphen is Vice President of Insurance Solutions at Sun Life, the sponsor for today's event. Hi, Michael.
Hi, Andre.
Okay. Beside him, Cassandra Millen, a registered social worker and psychotherapist. Welcome from your snowy location, Cassandra.
Thanks, Andre.
And finally, we have Michelle Weston, who's Director of Strategy and Innovation at Black Creek Community Health Center in Toronto. Really big health region, really popular community center with a lot of people with diabetes. So we have 3 good experts here to get us started. So if I could, Michael Van Alphen, I'll start with you. At Sun Life, you've commissioned some research on the cost of managing type 2 diabetes, both direct and indirect costs. Can you give us a taste of that data, what you learned from it?
Yeah, for sure. Thanks for that question, Andre. And I'll pick up on some of the comments that Laura said earlier. But, I think you heard from Laura and specifically some of the direct costs, but, the cost will vary and will change based on an individual's needs, and the impact of someone living with diabetes certainly goes beyond health. We conducted a survey to better understand some of the challenges Canadians living with diabetes face on an everyday basis. Of those surveyed, 1 in 3 said that living with diabetes makes it harder to save for their future. And more than a quarter of them actually have delayed major life goals because of their condition. So this is, as you heard from Laura, rising costs associated with eating healthy. Things like healthcare provider visits and even taking time off work are top diabetes expenses. And in the work that I do, I see how chronic conditions really reshape people's lives. Type 2 diabetes is not just a health diagnosis, it creates financial stress. It impacts mental wellness, right? It changes how people actually plan for their future. So the findings from our survey really underscore the complex relationship between health and finances, particularly of those managing chronic conditions like diabetes. So living with diabetes means that ongoing costs need to be accounted for in the short and the long terms. So what I would say, Andre, is what people really need to take away from this is the importance of having a budget and working with an advisor to create a long-term plan that includes, potentially life insurance, as it can give people peace of mind that their financial goals can be met.
But we kind of have this perception, well, if you have a chronic illness like diabetes, you're not going to get insurance. But you actually have a plan specifically aimed at people with diabetes, which is unusual.
Yeah, we actually launched a solution about a year ago. And again, I'd start by saying that life insurance can play a really important part of an overall comprehensive plan that allows Canadians to really protect their loved ones, right? So, and this is the case not just for those living with diabetes, but for all Canadians. However, what we saw is a distinctive gap in the market when it came to providing people living with diabetes with long-term financial protection. Canadians with diabetes are typically 4 times less likely than the average Canadian to actually even apply for life insurance. And those that do end up applying, many are declined, or maybe many are offered unaffordable premiums. So this gap in protection and these challenges is exactly why we created a solution, Sun Life Term Insurance for Diabetes. And we believe it's an important part of holistic financial planning. This product or this solution is an industry first solution that's actually designed to make coverage more accessible, to help people feel more empowered. And knowing that access and affordability are barriers that hinder Canadians with diabetes from obtaining coverage, we designed this product to offer a higher chance of approval and more affordable premiums. So the real takeaway here is that insurance should be seen as a foundational part of any financial plan, especially Canadians who may already be facing barriers to access the protection that they need.
Great, and we'll come back to talk about some of those, how to manage some of those financial challenges a little later. Michelle Weston, if I could bring you in, you work at Black Creek Health Centre. It serves Northwest Toronto. You have some of the highest rates of diabetes in the city. Talk a little bit about why. Is it about the ethnicity of the population? Is it poverty? What's creating this clientele? And then we'll talk about some of the financial challenges.
For sure. So unfortunately, high rates of diabetes in communities like Northwest Toronto is never a single answer, right? It's a complex intersection of, I would say, social, economic, and environmental factors. Communities like ours, we do have, rates of, lower income families and individuals. Often there's a lot of folks that are facing systemic barriers. So for instance, they could be new to the country. There are also a lot of newcomers. Because of that, they may very well be coming from some of those higher risk groups, such as what Laura mentioned, and that can increase their risk of developing diabetes, as well as impacting their challenges around managing diabetes as well.
And you deal well with the health challenges. That's what the health clinic's for. But what about the financial aspect? What do you hear from your patients?
For sure, we hear that it's an incredible burden. As Laura mentioned, diabetes is a chronic, unfortunately, often lifelong disease. It's something that can be well managed, but when I think you are facing some of those financial barriers, it can definitely impact on your quality of life. So we are working with folks again that may be lower income. We're working with newcomers that may not even have their provincial health insurance yet. So they may be having some very basic challenges, paying for their medications, accessing their medications. We are dealing with folks that are, dealing with food insecurity as well. So again, all of those factors have a huge, financial stress on people's ability to manage their diabetes. And of course, that leads to a lot of mental stress as well.
And if you're having trouble putting food on the table, putting healthy food on the table is even more difficult. Making choices between buying your meds and food, these are impossible choices.
Yeah, and there are unfortunately impossible choices that we see our clients having to make every day. And I think along with that, Michael talked about, some of the burdens around, having to miss work. So, some of the things that we've seen in our community too is that if you're dealing with precarious employment, you may not even have sick days to take time off work. You may not have private insurance to pay for your medications. So again, all of that just increases the burden and stress on yourself as well as your families.
Cassandra Millen, if I could bring you into the conversation. Thanks for your patience listening to us all. You've been working as a social worker, psychotherapist for many years. What are you seeing with Laura talked about the mental and emotional impacts of the financial strain. Can you talk a bit about that and what you hear from your clients?
Yeah, I think, to piggyback on what everyone has already shared, it really comes down to this ongoing feeling of almost helplessness when you're having to make these decisions between the food that professionals are telling me I should be eating and the foods that I can afford, the medications or the supplies that will help me manage my diabetes in a more favorable way, and decisions not only down to what do I feed my kids, but what privileges maybe could I offer my kids, or different aspects of my life that are being impacted by these financial choices. But I think the number one thing really boils down to this felt sense of helplessness. right? I'm doing the best I can with the resources that I have, and I'm still forced to make these decisions. Then there comes in this added factor of decision fatigue, to the point of just not wanting to make a decision at all. And then what I'm continuously seeing is dealing with the emotional impact of that. Right now, I feel like I'm failing at managing my diabetes, and I feel like I'm disappointing my loved ones because I can't provide this one thing that I want to do for them in this way. And then I'm feeling like I'm disappointing my employer because I'm missing this time at work, and it just continues to snowball. And it's pretty consistent amongst individuals with type 2 that I see in my office.
It sounds like quite a vicious circle. Does it have an
Yeah.
actual impact on your physical health as well?
Yeah, absolutely, right? I think when we start to, the mind and the body are connected. And so when we start to have this ongoing feeling of helplessness, or we're making these decisions to choose one thing over another, and, ultimately that then comes down to maybe not living within our means in some cases, or not living by our values in other cases, all of that has a toll on our physical health as well. That then has this other snowball effect where maybe it's a little bit harder to get out of bed one day, or this burnout is so overwhelming that we just get paralyzed in the thought of what we need to do next. And so then it gets a little bit more difficult to mobilize any sort of change at that point.
And with all these challenges, do people actually get to you? Do they get to the psychotherapist when they have so many other issues to deal with first?
Yeah, they do get here. But I think if I'm being honest, I'm seeing them at a point where that helpless feeling has already settled in, right? And then we're looking at how do we just step off the wheel for 1 minute to feel like we're moving forward and not just spinning. And the other piece is it's an adjustment, right? At the point that somebody is diagnosed with type 2 diabetes, that in and of itself is a significant life transition. We're learning, different ways of making adjustments to our lifestyle. We're learning different ways of managing something completely new, or maybe not new if we know somebody. Or we've had conversations with medical professionals around pre-diabetes. But at the end of the day, it's everything at once. And this leads to, what we've coined this term diabetes distress that really just boils down to burnout, right? It's overwhelmed. There's decisions. I'm having to, maybe adjust to a different medication because this one isn't covered, but I'm used to this one. What is that going to mean for me? There's a lot of anticipatory sort of nervousness that comes along with all of this as well.
And Laura, I see you there nodding about the term diabetes distress. Do you hear about that from your clientele?
Yes, all the time, Andre. I am nodding. In fact, one of the things I'm really glad we're talking about this is that it's really important with people who've just been diagnosed or living for a while to know if you're experiencing mental health challenges with that diagnosis or even living, you are not alone. In fact, if you have type 2 diabetes, you're 2 to 3 times more likely than the average Canadian to develop depression. And that's not your fault. That's not because you're not doing the right things. And there is a lot of stigma and misinformation about diabetes too. So it's a double-edged sword, Andre. You're actually been given this diagnosis. Often you feel it comes with shame and blame. And therefore, in fact, what we know is people with diabetes, especially type 2, almost 60% of them want support but don't seek it because they've got guilt or shame around it. So not only are you feeling overwhelmed, and you may have that diabetes distress, like you're burned out. There's no vacation from diabetes. It's 24/7, 365. You can't turn off your blood sugar going up and down. But on top of it, you feel like you might feel quite a few people with diabetes, type 2 diabetes, feel like, and I really can't seek support because I might have brought this on myself, or I might have done something. And then it just, as Cassandra said, we often call it like sort of a bit of a spiral down. The good thing is you're not alone, and the good thing is there is support for you. And how do you advocate for that? But know that this isn't just you, and I think that's really important for people to hear.
And everybody has said that word stigma. Can you talk a bit about that? How is there stigma with something that affects one in 10 people?
Yeah, I mean, I'll start and then Cassandra can probably add a lot. I mean, maybe I'll just give you an anecdote, Andre. So I got diagnosed about 8 years ago, and I had a lot of self-stigma. So part of that is when the doctor turned around and said you have diabetes. I didn't have it in the family. Mine is the cancer family, etc. And I really thought, I didn't go to the gym enough. I'm overweight. I just had all this misinformation in my head around what that was, to the point where I wasn't even sure I was going to tell my family. And I certainly, to Michael's point, wouldn't have gone to an insurance company because I thought, well, now I'm damaged goods and this kind of stuff. But actually, the first time I decided to disclose, and the fact that I even use that word, Andre, disclose, tells you the stigma. I was at dinner with a good friend of mine, and I thought, oh, I'm going to actually tell someone outside my family. And I said, I've been diagnosed with diabetes. And he literally said, nice guy, so good intentions. He said, the genetic one or the one you gave yourself? And let me tell you, after that, I didn't tell many people for a long time. So often the stigma, now it doesn't mean that people say, well, but you could have exercised more and you could, yes, diet and exercise play an important role, but they're not the only role. Your ethnicity, your family history, the environment you live, the things that Michelle talked about, there are many, your stress levels, like there are many, many things that can be going on there. So it's really important. And also in our society, this sense of like, you see on social media, oh, that donut was diabetes worthy. Like there's a sense that this is almost uh, like a disease that you could almost poke fun at, or that it's not serious. And really, when I talk to people and start to talk about what it's like to live with diabetes and that it's really quite serious and there are many complications, there's just a lot of people who don't know that. So the stigma is real for both type 2 and also type 1.
Yeah, leading cause of heart disease, kidney disease, amputation, blindness. It has a lot of health impacts.
Yeah.
Michael, you talked about stigma without saying the word, saying people are reluctant to go get insurance if they have diabetes. And how do you overcome that and make people say, oh, I deserve insurance as much as anybody else. I deserve care as much as anyone else.
Yeah, thanks, Andre, for that. Yeah, I think just building on the comments that have been said, talking about a chronic condition like diabetes can certainly be uncomfortable, right? And from the survey we did, it revealed that actually probably about 4 out of every 10 people were comfortable discussing diabetes with their advisor. So only 4 out of 10 would actually talk about having diabetes with an advisor. Yet the advisor is there to actually help create a financial roadmap, make sure that you have the protection that they need in place or saving for all the right things, but also to actually help support them. Because as we said, having diabetes isn't just a health diagnosis, it's also a financial diagnosis. It can impact mental health and so forth. So, what we saw was, barriers for some seeking advice included things like they felt like there was a separation actually between their health and their wealth, which in truth, the two are actually very, very connected, as you've heard from all the comments here today. The stigma and the judgment around the diabetes diagnosis, as Laura just touched on, is very real. And some may feel uncomfortable sharing their diagnosis, especially when you think about going and applying for life insurance, where you go through an underwriting process, right? And you're asked health questions. And so we really can't lose sight of the fact that although diabetes may be a lifelong condition, managing the financial impact doesn't have to feel overwhelming, right? So an advisor can actually help you understand the unique challenges that you're faced with, and can actually help create a tailored plan that will help manage the cost and address some of your specific needs. So, I would say really the best advice as you think about having these conversations is to start planning and start budgeting early. For many families, right, life insurance will actually play an important role in this planning process. And although it's not the only solution, I'd say, Andre, it can provide additional security alongside with things like budgeting support, saving plans, and programs like that.
And we'll come back to some of those financial resources that are available for clients. But I want to bring Michelle in. I saw you when we were talking about the stigma part. There was a lot of nodding going across the panel, but
Yeah.
how do you see the stigma play out on the healthcare end?
Yeah, I mean, I think, we've all spoken about the shame and the blame. I think for folks that, again, may be dealing with financial burden, may be dealing with shame, I think that has a huge impact on their ability to, share information with their healthcare providers. That establishing trust is crucial. And when you are needing to, work with your healthcare team, and diabetes does take an interprofessional care team to help you manage your condition, it's important to build those trusting relationships. So some of the things that I see even is working in a community where it's incredibly ethno and culturally and linguistically diverse. It's really important that you're working with healthcare providers that have a cultural understanding of the foods that you like to eat, understanding of social norms, because if you are going to be wanting to talk to your dietitian, for instance, about eating healthy, you don't want to feel that you're being judged, right? It's already challenging enough to talk to someone, about your diabetes. But if you are being told, to eat a certain food that you're not familiar with, or don't eat at all, that can add to the additional, feelings of shame and misunderstanding. And that's going to have a huge impact on your ability to, work with your team to help, improve your health.
Yeah, we had another event like this last year about diabetes, and we talked a lot about that culturally appropriate care because of certain cultural groups being more impacted. Can you, at places like Black Creek, do you offer financial advice as well as the health advice? I don't imagine that's the role of the doctor, but is there a social worker? Who does that?
For sure. I mean, so community health centers, such as Black Creek Community Health Center, where, community health centers are found across the country. They are great places as a first stop for someone who is living with diabetes or newly diagnosed with diabetes. As I mentioned, that interprofessional care team who's going to really, wrap around and provide you the support that you need, is an important part of, getting on the road to managing. So, diabetes education programs and CHCs may include, a diabetes nurse educator, dietitian, absolutely social workers who can help you with your mental health support. But then we can also help connect you from different supports that may be available, at the center or without. So it could be perhaps a community health worker or navigator to help you, apply for financial assistance programs. We've done even workshops on financial literacy, connecting people with, job banks or rent banks. All of those things, you can find at a CHC, and it's no cost to anyone. So it's a great place to, get started to connect with your team, but as well as, get those referrals and help navigate through the system that can help, get connected to those financial assistance programs.
And Cassandra, as a social worker, do you get involved in the financial part, helping people out? When I think of resources, I always think of paperwork. I imagine there's a lot of that too.
Yeah, I think in my role, primarily at this point in my career, I'm mostly tackling sort of the impacts, the mental health impacts. But having worked in a CHC about a decade ago, that's sort of where I would redirect the folks that I see is to our local community health center. All of our hospitals around also have diabetes educators, and all of us working together as a team to kind of support that. So that someone doesn't have that extra thing to worry about. When we talk about this burnout, some of it really comes down to all the calls that have to be made and all of the appointments and all of the scheduling and all of these things that also often take time away from work when we talk about financial impact, and having to take time out of the workday sometimes to fit those calls in. And so as much as I'm not offering that as much right now, really focusing more on the mental health aspect, there's such an appreciation and such a need for these resources in the community.
But not being able to access services, not having the time, that has a big mental health impact.
Yeah, absolutely. I think that, again, when we talk about burnout, some of what I'm hearing, or a lot of what I'm hearing, is the time that is dedicated to making the phone calls, to remembering certain things that need to be ordered or done, to schedule the appointments, all of the external resources. And I would venture to branch out a little bit and say it's not always directly with type 2 diabetes, but the complications as a result of type 2 diabetes, right? There's lots of other things that type 2 diabetes is connected to. And going back to what Laura and Michelle have shared around stigma, this is where the cycle kind of perpetuates itself. It's like, I have these complications. Now I'm blaming myself for these complications because, maybe I'm being told, or maybe I'm telling myself that I'm not managing it appropriately, but I'm not managing it, appropriately because there's these financial barriers that are getting in the way. And so it snowballs from there. And the cost aspect snowballs from there. There's costs associated to complications related to diabetes, not just the supplies, and the medications as well.
Yeah, if you start losing your vision, you need dialysis, you have an amputation, there is that
Yeah.
spiral there.
Yeah, absolutely.
Now, we have lots of great audience questions pouring in, so I'm going to start to try and get to them all. Laura, if I could start with you, this question about, we've been talking about type 2 diabetes, but pre-diabetes. You used the analogy, there's lots of people in the pool who have diabetes, but there's a lot on the edge of the pool that risk falling in. So people are asking, are we doing enough proactively to do prevention? What are the financial costs of that? Could people do more sort of glucose monitoring up front and things like that? So talk about that pre-diabetes group.
Yeah, so great question. And the quick answer is I don't think we're doing enough, but it's really complicated. There are many moving parts, as Michelle was talking about. So just to give people a sense, if there are 4 million people in this country who live with diabetes, and 90% of those are type 2, there are 6 million people who have been told they're either at high risk or they're actually pre-diabetic. So if you think about the 4 million who with it and the 6 million at high risk or pre-diabetes, that's 10 million Canadians, and our country is 40 million. So we're talking about and so those folks, we talk about people with diabetes in the pool. We talk about those people on the edge of the pool with their feet in the water already, and what can they do? And are there financial implications? And absolutely. So first of all, we find that people at the edge of the pool, they might know they're at risk, but they might have lost their family healthcare provider. They may not have a primary healthcare provider. So as you're thinking, if you know you might be at risk, are there other solutions? Can you be talking to your pharmacist? That's often something you can say. Is there a place I can go to get my A1C, that's your blood sugar level checked, so that you don't just all of a sudden find yourself, you have diabetes. What are you doing? So is there a way you're monitoring that? Second, are you thinking about diet and exercise, etc., if you know you're at higher risk? And I say that though, and it's easy to say, it's hard to do. Because if you're working a lot, a couple jobs to make things, if you're new to the country, etc. We do get questions now, Andre, about continuous glucose monitors and whether those would be useful for people to wear before, etc., etc. I mean, they're not cheap if you're paying for them out of pocket, and they're not really intended to be used as lifestyle, right? We do see some of the celebrities wearing them and all that sort of stuff. Really, what I would say is that's not so helpful, because how you learn about your blood sugar going up and down, it's better to try to find a healthcare provider. And if that's not a doctor, is that a pharmacist? Is that a nurse? Is that even a dietitian that you can be talking to about this, rather than sort of taking your cue from the devices? And again, as Michael was saying, it is, if you are pre-diabetic, are there things you can be thinking about from your financial planning around, might I need to be thinking about investing a bit more in the healthy foods? But what's that trade-off? Is that my kid not joining hockey, or is that, what is that, and how do I think that through? To me, the most important thing is, is there someone you can talk to about that? Is that so that you're not just out in the cold and all of a sudden you've got your diabetes diagnosis? Is there someone, and again, I know people say, but I don't have a primary health doc. Okay, so are there other folks at your CHC, at your pharmacy? Phone our 1-800 line. We have folks that we can talk you through things. What are resources in your area? That kind, and we get calls from across the country. So yes and no, because it's really hard. As often, I heard once, I was at an Indigenous diabetes health conference, and for some folks, particularly Indigenous, but also people from the Black community and South, it almost can feel like diabetes is in the mail. Like it's coming, it's just a question of what day will that mail show up in your box. So how might you be thinking proactively about that? But that will have some financial implications if it's about trying to get healthier eating or exercise. But very important to know that even if you invested and you went and had a personal trainer and ate everything, you may still get diabetes, and that's not a failure. It's not a failure. And that's really, really important for people to take away.
But you're right. We hear that in some communities, everybody has the sugar and I'm going to get my turn, for example. We have to address that earlier.
Yeah, and sometimes that actually makes people dismiss it more. They're like, well, it's just the sugars. And everybody has it. And but we talked about there's in the pool, many people are in the shallow end, and I knock on wood, I am too. You don't want to slip down to that deep end where you're thinking about kidney, just, as you said, blindness, heart attack, stroke, amputation. I mean, so yes, it might be common in your community. That doesn't mean you don't need to take it seriously. And think about what might you do to either keep yourself in the shallow end or not go into the pool to begin with.
Okay. And Michael, if I could bring you back in, there's a couple of things. One, I want to pass on a comment from the audience. One is saying, knowing that insurance companies have programs for type 2 diabetics, really, they feel reduces the stigma. So they're thanking you for that. And then a question asking, is it better if you come forward earlier when you have this pre-diabetes, you have these warning signs? If you go to an advisor then, are they going to help you avoid getting along there as well as healthcare providers?
Yeah, so first, thanks for sharing that feedback. Supporting Canadians living with diabetes has been a really important cause for Sun Life as a whole. I would maybe just build on a couple of Laura's points. Like again, there's actions that individuals can take around looking at opportunities to continue to manage their health and their well-being. I think, from my perspective, again, when you bring it back to the conversation around financial health, especially when managing a chronic condition, whether you're pre-diabetic or whether you're living with type 2 diabetes, I think there's different strategies that can support both your financial health, but also your well-being. So, I talked about earlier, the importance of planning. It's never really too early to start planning financially. Things like, knowing the impact of what chronic conditions may have on your long-term finances. Those are things that you can do to better anticipate challenges going forward, putting money aside as you think about that. So when, maybe not answering the question directly, Andre, but when I think about managing financial health, those are a couple of things that I would certainly encourage people to do. As far as putting the protection in place, it comes back to having a really robust financial roadmap as you think about, protecting your loved ones, protecting yourself, and getting the coverage in place. So working with an advisor to develop a comprehensive financial roadmap at any stage of your life allows you to then put security in place to really help you achieve that financial security that you need and support your well-being.
Great. Michelle, if I could bring you back in, we have a lot of questions that people are noting. A lot of Canadians, almost 6 million, don't have a family doctor or a primary care provider. What can you do to be screened, to have better prevention if you don't have that frontline help? What do you do?
Yeah, I think that's unfortunately a problem across the country right now. Again, there's a lot of, services, free services available through your community health centers. Laura mentioned about connecting with pharmacists as well. So I think connecting with an interprofessional care team is important to just manage your health overall, even if you don't have a primary care provider right away. There's a lot of, innovative programming happening at a community level as well. So we've been working with funding through Public Health Agency of Canada to actually train some community members to be health coaches, right? To help sort of, support people through early intervention and early prevention to help, reduce or delay, the impact of diabetes. I think another thing folks can do is to really, get connected to the information that they need and early screening. So you can get, testing in some places at pharmacies for diabetes, or even going to like a mobile clinic. Things like that can help get you familiar and aware about your risk of diabetes so that you can start to address it while you are getting connected to a primary care provider.
And related to this, people are asking, where can you get education, especially if you're in a high-risk community? Is that easy to find?
For sure. So again, you can connect with a community health center. You can, in Ontario, there's the Alliance for Healthier Communities that can let you know where your local community health center is. You can also check again with local hospitals as well that have diabetes education programs or family health teams. And then across Canada, there's also the Canadian Association for Community Health Centers as well. That's all, available. You can check with other health providers in the community that can connect you with resources as well.
And
Andre,
Cassandra, yes.
I was just going to say too, if you're looking for resources, diabetes.ca, our website, has lots. And for example, with the new year just rolling around, we are just launching our virtual diabetes education program. And it's free. It's completely free. It happens once a month. You can come on. We have different healthcare professionals. You can ask questions. You can get connected to our Diabetes Canada Connection online peer support. And even if you're not yet diagnosed, you can come on these. We have lots on pre-diabetes, at high risk. Again, we have it in different languages. You can call our 1-800. So I'm with Michelle. If you're even worried about this, or you've been told at some connection in your healthcare journey that you might be at risk, or your A1C was creeping up, then next time you're in healthcare, even if it's not for diabetes, can you ask, how can I get this checked? I'm worried. Should I be worried? What might you suggest? Because be your own advocate. And you're probably in the healthcare system in some way, and can you take that opportunity? But there's lots of education resources out there, and diabetes.ca is a great way to think about that.
Yes, and many of them are free as well.
Great. And Cassandra, following on that, talking about free stuff, people are saying, well, a lot of the things I need to do to treat my diabetes, to prevent it, is fitness programs, mental health supports, nutrition. Most of those things aren't covered by Medicare. How can I get help if I don't have the money?
Yeah, that's a great question. I think I'll speak to sort of the mental health side first. As Michelle was saying, a lot of community health centers have diabetes programs and social workers on site who are able to provide counseling, and every model is a little bit different, I know, but Michelle, you spoke to that earlier as well. And that is a free resource in the community, and there's lots of mental health agencies that offer free counseling. And then a lot of even private practice clinics do have opportunities for folks to access free mental health care as well. I can't sort of speak beyond my own situation, but I know at our clinic we want mental health care to be accessible, and we understand that there's financial barriers to that too. And so, a lot of times it is kind of asking and seeing what's available. If there is a particular clinician that you're wanting to work with, often there are resources there. It's just a matter of asking, and it's not always necessarily as open or well known to the public. But I think there are lots of publicly funded resources as well through community health centers that have that direct link down the hall to the diabetes educator. Diabetes programs within the hospital system often have a social worker attached to them as well for the mental health side of things. In terms of other resources, like working with a nutritionist or a dietitian, I would argue the same, right? Often embedded in family health teams, community health centers, diabetes education centers. These are all free resources, and that would often be the first recommendation for me as someone who's looking to get connected to that resource as well.
Great. I think we're going to create a lot of work for diabetes educators today, but that's probably a good thing. So overall, Michael, I know you work on the life insurance side, but I'm going to try this one on you. It's not exactly related, but people are asking, can your benefits plans at work can they be helpful in getting help for diabetes or pre-diabetes? So that insurance, but more the health insurance side.
Yeah, absolutely. Absolutely. When I think about the overall financial burden of diabetes, for those, whether it's without access to devices and medication, through their workplace benefits, that's one place where you can continue to look for coverage as your workplace benefits provides, in some cases coverage for that. I think again, it's about thinking about planning holistically, taking into account whether you have coverage through your workplace or whether you are getting access through an advisor. I think it's about thinking about holistically your financial plan and how to actually put a plan together that will help meet both your protection, your wealth, and your health needs holistically. So it's really looking at all avenues for you, which again, I think reinforces the importance of the role of an advisor to actually help provide the advice that you need to make sure that you've got the coverage in place to protect you and your loved ones.
Good. Laura, another question I'll send your way. People are saying, we've talked a lot about government programs, how they're different all across the country, but is Diabetes Canada also doing work with pharma companies to try and bring down the cost of drugs, things like GLP-1, other drugs that you use? That would be an important way of saving costs.
Yeah, so Diabetes Canada does a lot of work around advocating for people who live with diabetes, and that is getting equitable access to things like medications, supplies, and devices. Generally, that advocacy is with governments because we want the governments to pick up these costs, right? To make sure it's on what's called the formulary. So if you go, all of a sudden it's covered for you. We generally don't advocate to the pharma companies themselves. What often happens, and this is just happening now, Andre, with GLP-1s, these Ozempics of the world, is actually they're going to generics. And then you will actually see quite a reduction in costs coming. So the answer is yes, we are trying to make sure that whether you live with type 2 and whether you're early or later on, that for you, access to medications, whether it's through government programs or your benefit programs, you have more access to the wider range of drugs.
And if I can give myself a plug, in tomorrow's Globe, I have a column about GLP-1 drugs, and I talk about that. The prices are going to fall by about 2/3.
Yes.
So that'll
Gonna be
have
a
some
big difference.
impact, especially for insurance companies and individuals.
Yeah.
Michelle, another question I think I can send your way. Someone's asking about, do we need more financial support for marginalized communities in particular? Are they getting the help they need?
Absolutely. They definitely need more support. We talked about sort of the risk factors and financial burden of diabetes. These are systemic issues, right? So the impact of their built environment, access to health care, affordability of housing and food is definitely, a systemic barriers in these communities. So they absolutely, need more support. While diabetes is a chronic condition and it's so important to get that education and connecting to resources and your team, until those systemic barriers are addressed, self-management is going to be incredibly challenging for many of these communities still.
And your peer support, things like that, can do a certain amount, but you can't do everything.
Absolutely. I think, programs, community-based and peer-led programs are really important to reduce social isolation, make you not feel like, you are alone in all of this. And also they can help you navigate through the system as well, which is an incredibly important part of managing diabetes.
Laura, I think this one I'll send to you as well. Someone's noting that people with diabetes often don't just have diabetes, right? They have other health issues. Are there lessons you can learn from the way we're tackling diabetes that apply to other conditions, other chronic conditions?
Yeah, it's a great question, Andre. And the quick answer is yes. And in fact, many provinces are looking at actually chronic disease strategies, because it's really about people getting diagnosed with something, whether it's diabetes, whether it's some heart related, either from their diabetes or not, whether it's even arthritis. And now some cancers are chronic too, right? People are living with that. And how is the healthcare system better set up to manage someone who's going to live with a disease or a condition for a very long time. And so absolutely there are lessons here. The other thing I think it's worth saying, Andre, here is sometimes we get people say, oh no, my loved one didn't have diabetes, but they had a heart attack, then they had to go on dialysis, then they lost their vision. And it's like, probably it was related to their diabetes. And so again, thinking about how these diseases often all intersect is really important. That the human being isn't just one thing, but also that diabetes is really important to tackle because it often leads to other diseases. And so what are we thinking about with that? And how do we, for example, for someone who lives with diabetes, I often am talking to I'm lucky to have the privilege of an amazing primary health care doc talking about heart issues. Am I getting my eyes checked? What about my kidney? Because they are all connected, and the healthcare system needs to be more integrated around that.
Great. Cassandra, a question for you. You mentioned, the stress at work of having diabetes, for example. Someone's asking, can you give some suggestions we have some employers on listening in today. How can employers do better, offer support? How can they address stigma in a way that will help their workers?
Yeah, that's a great question. I think some of the things that I hear, and I'll share, a bit of bias myself as someone living with type 1 diabetes, slightly different, but the same fears around how will it be perceived if I'm not coming to work because of a diabetes related complication or issue? How will it be perceived if I have to leave early? Is this another sick day? Will I be viewed as incompetent? And so I think for employers, what I would really recommend or encourage is being open to those conversations around what that needs to look like. I think for a long time, and I hear this in my office, this has been my personal experience, not wanting to share that people are living with diabetes because they don't want to be underestimated in their capacity, or they don't want to have that stigma that we all wish wasn't there, but is there, follow them around the workplace. And so I think if there's a bit of an open communication about what that needs to look like, and ask maybe of what do you need for this to work for you, so it can work for all of us, these types of things, but really educating yourselves as employers as well on what the reality of living with diabetes is. And we've talked a lot today too about the complications, right? And it's so, yeah, there might be an appointment every 6 months for diabetes, but there might be 3 other appointments in that 6 months related to something else that is not directly diabetes, but is linked. And so education and open communication are the 2 things I would recommend.
Great, a good message to employers and to everyone overall. We only have a couple of minutes left, so I want to ask each of you to sort of give us a take-home message and hopefully something forward-looking. I always like to end panels on a hopeful note, especially these days. We need some hope. So I want to ask each of you, what's making you hopeful that we're going to address this big issue of the financial impact of diabetes on Canadians? Michael, I'll start with you. You sounded very positive with your insurance program, but tell us what makes you positive.
Yeah, thanks, Andre. This discussion is a really important discussion. So really happy to be part of this discussion today. I think about the impact of diabetes. It goes well beyond health, as you've heard today. It creates, it does create financial stress. It does impact mental health, mental wellness, right? It really changes how people plan for their future, right? But there is opportunity as you think about building a robust financial roadmap, as you think about accessing different programs that you heard about today. One of the things that I actually didn't get to talk about was our diabetes care program here at Sun Life, which actually helps people improve their overall health and well-being. And this program is provided for individuals looking for guidance on actually how to manage their diabetes and improve how to manage living with diabetes. So to me, I'm quite hopeful, and I know there's a lot of investment, and there's a lot of people and organizations like the ones you heard from today that are helping support Canadians living with diabetes, and so that provides me a lot of hope going forward.
Great. Michelle, Are you hopeful your patients are going to get better care, more help with their financial needs with diabetes?
I think so. I think, my motto is if there's a problem in community, then community has to be the center of it. And there's a lot of innovation and amazing things happening in the communities through CHCs, through community-based programming, all of those things. And I think that community will be supported and connected.
Good. Cassandra, you positive that people are going to get some help with the stress of diabetes and the financial cost?
Yeah, I think the more that we have these conversations, the more we're building awareness in the communities across Canada. And so, yeah, I'm very hopeful that the more that we can talk about it, the more that we can educate and inform people of resources, the further we're going to go with this.
Great. And Laura, you started us off today. Can you end with a very positive, inspiring message for us?
Yeah, I think as the other panelists have said, when you bring something out of the darkness and put a spotlight on it, you already are making a difference. And we're really starting to tackle that misinformation about diabetes. Having a thing like this, Andre, is really like, okay, let's put this in the center. Let's talk about it. Let's take some of the shame away from it. And let's talk about the real impacts that there's physical, mental, financial. And what I really want for people on this call, especially if you live with diabetes, you don't have to go this alone. There is support out there for you, many different kinds for the physical, for the mental, and for the financial. And so know that you are not alone. Know there's support for you, and you can live well with diabetes.
Good final message. I want to thank our panelists, Laura, Michael, Cassandra, Michelle, for bringing this topic out of the darkness to our readers. On behalf of the Globe and Mail, I also want to thank Sun Life for making today's event possible. And of course, thank you to the audience for tuning in from across Canada. Really great questions. I barely had to prepare anything. You had all the great questions. On your screen now in a second, you're going to flash a QR code. It asks you to scan it and fill out our post-event survey so that we can improve our experience with these webcasts. This is our second one about diabetes. We might have more because there's a lot of demand out there. We'll also send you the survey by email. Finally, we'll be sending out a link to the recording of today's webcast. It'll come within a couple of weeks. So anyone who's registered, even if you had to duck out early, you'll get a copy of that webcast. And finally, thank you everyone for tuning in. Stay well, take good care of your diabetes, and of course of your financial health. Until next time.